Thanks for watching this interview with Dustin Rudolph, the plant-based pharmacist. You can check out his website and his Facebook page and his book in the description below. I'll leave links. In 5 years of being on this lifestyle, not a lot surprises me, but reading this book, it was a wealth of knowledge, and I read a lot of stuff that I didn't know before, so I highly recommend this book. I understand a lot of people don't want to watch a 1-hour interview, so what I've done is I've segmented this 1-hour interview into questions and topics. You can go down to the description and click on the hyperlinked time that will fast forward you to that particular topic or that particular question. So if you're not interested in these subjects, but you really want to hear what Dustin has to say about this subject, you can skip forward to that. I understand. An hour or an hour and 20-minute interview is a long time. So I hope you enjoyed this interview, and comment and ask questions down below. Thank you very much. I want to, if it's okay with you, I want to skip a couple of the additional questions I had and go right to the questions that were submitted by people who follow the Plant-Based Cyclist Facebook page, and also people within the Let Food Be Thy Medicine group, if that's okay with you.
Yeah, it's a great group, by the way.
It is a great group, very supportive, great administrators. They keep the junk out, they keep the crap articles out, and all the spammers, which is huge on Facebook, and they do a really terrific job. And I want to start this off by saying, if for any reason you want to skip one of these and say, I'm not really comfortable with that, I don't know a whole lot, no problem. And the second thing is that for anybody who is watching this who may have one of these disorders, diseases, or who you're like, oh, that's a great question, I can benefit from that. What we're both saying, especially you, the advice you're giving is not should not be followed without letting your doctor know. Correct?
Yeah, absolutely.
Okay.
Because there's sometimes you get some of these questions and they're kind of loaded questions, and you don't know like 9/10 of the story. So you always have to check with your healthcare provider, your physician.
Right. Consult with your doctor, ladies and gentlemen. We have a question about CoQ10. Can you talk about, do you know what is it for, is it beneficial, and what brands you may recommend, or plant-based alternatives?
Well, CoQ10 is really a substance that is involved in the electron transport chain. So that's the process that happens in the body, usually to make energy. So it also acts as an antioxidant. So those are basically the two main functions: is to help make energy and to act as an antioxidant. So some people will take it, I think it's marketed to take with just about every disease out there. But a lot of people will take it if they have heart disease, or sometimes if they have cancer, to help them with those diseases. And I'm not saying that it doesn't work. Maybe it does. I haven't read an extensive amount of studies with it. But here's my take on anything, whether it comes a prescription, over-the-counter supplement, or a new diet, or whatever you want to try, a device or a procedure or whatever, is that the safest, most effective, and least costly method to fix your problem? You know what I mean? So if you're taking it for heart disease, and you have high cholesterol and hypertension and all this, and you want to help yourself prevent a heart attack or a stroke, well, you could do all that same stuff, and you can do it with just a change in diet. You can change your diet to a whole foods plant-based diet, and you can eliminate your risk for heart attacks and strokes. Or if you're taking the CoQ10, I think it's like $10 for a month's supply, or $15 for a month's supply. If you're going to take that, it's basically just like a prescription where you're going to have to take it for the rest of your life. If you really want to get the benefit of it.
Right.
So if you're taking that, I actually worked that out, the numbers out on that. So if you take it for 20 years, that's $2,500. Take it for 30 years, that's $3,000, $3,500. So is that worth it to you? spending that. I mean, I'd rather spend the $2,500 on food.
Sure, produce.
I mean,
Yeah.
and there's always side effects. So, there's always, even if it's a supplement, there's almost always side effects. And with CoQ10, there are some side effects. I believe some GI disturbances like heartburn and maybe nausea, vomiting, those kind of things can pop up. So it's just, you have to, I'm not saying don't take it. And I'm not saying do take it. I'm just saying, like, with any pill that you take or any medical procedure, anything that you do medically, you need to look at the pros and the cons and the cost of it and the safety of it, and is that worth it to you?
Right. Right. And unlike any pill or supplement or CoQ10, unless you are specifically allergic to a vegetable or fruit, there's no side effects of eating broccoli. The side effects are good side effects.
Exactly.
We had a question about thyroid and nodules. Now, some of these are a little vague, and like you said, it varies from patient to patient. Have you read any studies having to do with natural remedies for thyroid nodules?
I don't know of any natural remedies for thyroid nodules. I know that I think another question I saw that you'd sent to me was about hypothyroidism too. So when it comes to the thyroid health, there are autoimmune diseases that commonly cause thyroid problems, and one is Hashimoto's disease, which is hypothyroidism. Another one is, I believe, Graves' disease, which is the hyperthyroidism. They're both autoimmune diseases. So those are the majority of thyroid problems in people. Now, of course, if you're hyperthyroid, that means you're producing too much thyroid.
Yeah.
Sometimes that's caused by a tumor that's on the thyroid, and maybe it's cancer, but maybe it's not cancer. It can be a non-cancerous one that's just making your thyroid go into overdrive and now lots of thyroid hormone. So a lot of times in that, there are medications that you can use, but they also go in and they do ablation, or they do surgery to actually disable part of the thyroid or cut out part of the thyroid that's causing the problem.
Right.
Now, hypothyroid, that's a different story, especially in Hashimoto's, because now you have an autoimmune disease that's permanently destroyed your thyroid cells.
Yeah.
And if once they're destroyed, it doesn't just grow back. So the only thing that I know of is to take medication, the levothyroxine and the other various manufacturers that make that, to basically replace that thyroid hormone in your body.
Great.
Now, there is one person that has done quite a bit of research on hypothyroidism. It's Elena Wilkins. She's in the plant-based community. She has a website, vegalicious.com.
Okay.
So if you just look up Elena Wilkins, she actually has, she said that she's cured herself of hypothyroidism by just changing her diet. And she said that she's had clients too that she's taken on that have also been able to do that. Now, I don't know the whole backstory with her medical and her chart and everything. So I'm not saying that I've never seen an interventional study that's been able to put people on a whole foods plant-based diet and reverse hypothyroidism. But obviously some people have benefited tremendously by doing that. I have seen studies that have shown you can prevent hypothyroidism by going vegetarian or vegan. There's less of a risk and there's less of a rate of hypothyroidism in those groups. So
good, terrific. So I mean that covered the Hashimoto's question number 16 that I sent to you, and also thyroid drug replacements. Is there any? Can you any changes through diet to perhaps get off of thyroid drug replacements? And I think you kind of covered that as well. Is there anything else that you want to say on that?
The only thing with thyroid medications, if you're on the levothyroxine or Synthroid or whatever brand that you're on, that's considered a narrow therapeutic index drug, which means it has a very small window in your blood that it has to stay at to work properly. So you have to go back and get blood tests and make sure that you're in that window and if you're not, you adjust the dose by just a little bit up or a little bit down, and you got to work with your doctor with that. So don't go messing with your medication and your doses with that. And when you're on a medication, I would stay on that same manufacturer. Like if you're on the generic, stay on the generic. If you're on the brand, stay on the brand. Because when you switch manufacturers like that, it can tweak it just enough that you go outside that window and now you have to go and adjust your dose. So just be very careful if you're on thyroid medication.
Good advice on that. We had several members put the thumbs up on this next question. They wanted to know your take on vaccines. Have you read any studies that suggest that there's a lot of hype in the media right now that vaccines may be harmful in some way? Can you touch on that at all?
Well, I'm certainly no expert in vaccines, but I have read a little bit on a few of them. Now, they do use some preservatives like thimerosal, mercury-containing preservatives like thimerosal in some of these vaccines and other chemicals in them. So, are some of those harmful? Possibly. I haven't read enough to see overall, what the take is. And I don't think that you can just make a blanket statement and go, all vaccines are bad.
Right.
Or go, everybody needs every vaccine.
Sure.
It's way too complex to do that. And it wouldn't be responsible to do that. Now, I have looked at the flu vaccine for one, and I've gone to the Cochrane collaboration is a great one to go to. Look at the Cochrane reviews on some of these vaccines, and they do probably some of the best jobs at telling you unbiasedly whether a particular vaccine is good or whether it's maybe not as effective as we thought. Now, with the flu vaccine, what they do is they take the flu strains from the last couple of years,
right,
and then they put it in like this year's model, and then they, give that to people and hope that that protects people. Well, the flu is caused by over 200 different viruses.
Right.
And it's constantly changing. So you'll see a lot of reports, even in the media, that says, this year's flu vaccine wasn't as effective as we'd hoped it to be. And that's pretty common. From what I read in the real world situation, 100 people have to take the flu vaccine for one person to avoid the flu. So should you take the flu vaccine? I don't know. Is that worth it to you? I can't make that decision for you. You have to make that decision. But when like the pneumococcal vaccine that prevents pneumonia. Now, pneumonia is not caused by over 200 plus organisms. It's a lot less, maybe 20 or 30. So your chances of being helped by the pneumonia vaccine are a lot higher, especially if you're elderly or have some respiratory issues, than using the flu vaccine. It doesn't mean you should get them both or you should not get them both. That's up to you.
Right.
You have to take that into account.
Right.
But some of the vaccines have been very important in history. Smallpox vaccine, polio vaccine. I had a gentleman that is from my hometown. He had polio, and I can remember as a kid, one of his sons was a year ahead of me in high school, in grade school and high school. And I just remember seeing his father all the time come to the ball games and school functions and stuff for his son. And he was crippled. Right. He was crippled from polio. Right. And, I look at that and I see how much of an impact that had on him and his children. And, I'm thankful that I got the polio vaccine when I was a kid, because I never want to have to go through what I saw him go through. So it's kind of it's a complex subject.
And just as a little plug, I'm going to be making a movie hopefully in the next couple of weeks on this very topic, on vaccines, because I think there is a lot of misinformation out there. So stay, all the fans of this who are watching this movie, I'm going to make a movie on that. Well, good. Thanks. That's a great answer. Can you talk about B12 supplementation for those on a plant-based diet? Is it beneficial? How much should we take? And can you recommend any brands or any sources?
I definitely think that people should supplement with B12. B12 is one of only 2 vitamins that you can't get in plant foods naturally. Well, especially with the quality of our soil and how we grow things nowadays. B12 is actually made by bacteria, and there is you can get B12 supplements for real cheap. Probably $5-10 for a big huge bottle of it. And it's important because B12 does three things. It helps with DNA synthesis, it helps with the formation of red blood cells, and it helps with the functioning of your nerve cells and your brain cells. So if you don't have it, you can become anemic, you can start to have central nervous system problems, memory, cognition problems, forgetfulness, those kind of problems. And it's very important. It takes years for that kind of stuff to show up after having a B12 deficiency. So you're talking anywhere from, I think, an average of 7 or 10 years before symptoms will start to show up. So it's just something that's real quick and easy to do. Take a B12 supplement. It's water soluble, so you can't overdose on it.
Sure.
And I always recommend to take anywhere from 500 to 1,000 micrograms a day. Your body doesn't actually absorb all of that. You only absorb about 1 or 2% of that. And the daily intake for humans that you need on a daily basis is only about 10 micrograms.
Right.
So 10 micrograms is 1% of 1,000.
Yeah.
If you only absorb 1 or 2%, if you take 500 or 1,000 micrograms, you're getting all that you need. And vitamin B12 is it's dependent on intrinsic factor in the gut. That's what it kind of latches onto to get absorbed into the bloodstream. So if you're a person and you have a deficiency in intrinsic factor, then you might have to look at maybe getting B12 shots or doing sublingual B12 or doing the patch of B12. So it's just something that you want to check with your doctor on. But you can see what your B12 level is. You can have your doctor do a very easy blood test, see where you're at. You can do a B12 level, see where you're at. You can also do a methylmalonic acid level. That kind of is a marker of B12 status. Some say it's a little bit more accurate as far as true B12 status of an individual. Those are both blood tests, and you can have your doctor do them and take care of some serious medical problems and anemia and mental cognition problems that nobody would go through.
Gotcha. Sorry.
As far as brands, I don't have any specific brands that I usually recommend.
Gotcha. And I apologize if you may hear my dogs in the background barking at people on the sidewalk.
Very friendly.
Can you talk about aspirin? Someone wanted to know about aspirin. She takes a 1-a-day aspirin. Any potential side effects on the body long term, or she said specifically, could it interact with a drug like lisinopril?
Okay, so with aspirin, the biggest and most the biggest side effect that we would worry about is bleeding.
Okay.
Because aspirin is basically an antiplatelet drug, so it reduces your platelets. You need platelets to clot and help you so you stop bleeding.
Right.
So you can bleed easier. If you cut yourself, you're not going to clot as easy. You bruise easier with aspirin. And especially if you're taking it with other medications that also thin the blood.
Right.
Some people might have, atrial fibrillation. It's a heart arrhythmia, and they go on aspirin. Maybe they're on warfarin, which is another blood thinner. So they're on a combination of products. Some people might have had a stroke or a cardiovascular event, and maybe they put on Plavix, which is an even more powerful antiplatelet, and then they're also on the aspirin. So when you combine drugs like that, you really got to be careful, because then it can really thin your blood and you can bruise and bleed easier. As far as aspirin and lisinopril, there is a slight interaction there. It's not a major one, like if you have two blood thinners together, but it can cause a lower efficacy rate of lisinopril, of the antihypertensive effect.
Okay.
So in that case, I haven't personally seen it, but I know that it's out there, that drug interaction is possible.
Okay.
It's one of those that you might have to have your doctor increase the lisinopril dose to get the blood pressure to where it needs to be. But then again, blood pressure is usually a nutritional disease. And if you take care of the nutrition part, a lot of times patients can get off or at least reduce a lot of their medications for that.
Very good. Very good. Any natural plant-based cough remedies when you're sick that you've heard of, that you've read about?
Boy, not that I know of.
Yeah, and that's fine. Some of these questions are a little bit more kind of herbal and less medical than others, but okay. And if you think of one, you can always chime in a little bit later.
A lot of prescription cough medications I could tell you about,
There you
but
go.
I don't know of any natural ones.
Gotcha. Iron ferritin tablets, yay or nay?
That's kind of a loaded question. Like I don't really know. That's really a loaded question. It's like, why are you taking iron?
Right.
Do you have iron deficiency anemia?
Mm-hmm.
Do you have anemia at all?
Mm-hmm.
Sometimes anemia can be caused by B12 deficiency. There's all kinds of different reasons why you might have an anemia,
Right.
and it might not be iron,
Mm-hmm.
but it might be iron,
Mm-hmm.
and so maybe you do need it.
Mm-hmm.
Iron ferritin is basically helps restore the stores of iron that are built up in your body, that in your bloodstream. So it may be beneficial, it may not. It's all depends on the medical condition.
Right, and on the person, on the individual person. So in other words, I think what you're saying is consult with your doctor. There's also
Right.
a lot of plant-based sources of iron out there. So just do a Google search on plant-based sources of iron and see if that helps as well.
Yeah, beans and greens are great for iron.
Beans and greens.
Yep.
COPD and a steroid long-active inhaler.
Mm-hmm.
Is there another way? Is there an alternative to that you've heard of?
Well, actually, there are studies out there that show that eating more fruits and vegetables and whole plant-based foods like that help to reduce the, I don't know what you want to call it, maybe the symptoms or the severity of COPD.
Mm-hmm.
And I think one study in particular that I saw, they took two groups of people and they just asked the one group of people to just eat one more serving of fruits or vegetables a day, and the other group they didn't say that.
Mm-hmm.
So the group that did not eat one more serving of fruits and vegetables a day, of course, their lung function steadily declined over the months and years.
Mm-hmm.
The group that did eat more fruits and vegetables, it kind of stayed even, their lung function,
Mm-hmm.
and it didn't necessarily get terribly worse, but it didn't get phenomenally better.
Okay.
Which is still a good thing.
Sure.
Because there's no side effects to eating fruits and vegetables. And COPD is a chronic disease that the progression of the disease is basically you're losing the permanent function of the alveoli and the other the other cells and tissues in the lungs they don't work.
Sure.
Because you have emphysema, or you've been exposed to smoke or pollutants or whatever it is to cause that. And so over time, the way that COPD works is, you start out with really good lung function way up here, and then you get COPD, and eventually you get worse and worse and worse and worse and worse, and then you die.
Mm-hmm.
And that's just and that's with the best medications.
Mm-hmm.
So usually we start people out with COPD on a short-term bronchodilator to try to open up their bronchi and their airways.
Yeah.
But sometimes that won't work, and so we'll have to. The next thing you go is you go to a long-term anticholinergic inhaler like Spiriva,
Mm-hmm.
or Two Doors, I think is another one. Or you go to a long-acting bronchodilator like Formoterol or Salmeterol, and then you can, once those, they'll work for a little bit. They'll help control symptoms. But eventually, like I said, you just kind of keep going down
Right.
with your function. So once you start getting worse, that's when you add maybe a long-term steroid inhaler to these long-acting bronchodilators or the long-acting anticholinergic inhaler. And sometimes you end up with people on all three.
Mm.
And at the end stage of their disease. But COPD it's not something that you can really reverse that I know of.
Okay.
You could just hope that you can keep it at bay as long as possible.
Good. Very good. Someone had a recent stroke. Their friend recommended taking zinc sulfate to repair nerves that may have been damaged due to the stroke. Are there any plant-based remedies, first of all, to strokes, and second of all, to add more zinc sulfate to your diet, if that's even necessary?
The zinc sulfate, I'm not sure on.
Okay.
I haven't read anything on that. Now, as far as strokes, yeah, just eating a whole foods plant-based diet, eliminating or reducing the animal foods, the high-fat foods, the oils, those kind of foods will help prevent strokes. Now, once you have a stroke, depends on how bad it is. Some people are completely disabled and they can't even care for themselves anymore.
Right.
Some people, I have a friend who had a stroke, and she has partial blindness on her peripheral side on one of her eyes. So, sometimes it can do a lot of damage. Sometimes it can do a little damage. Sometimes that damage is permanent. Sometimes it's not. Sometimes you can work through it with physical therapy, occupational therapy, that kind of stuff. But the best thing that we know of is to eat a healthy plant-based diet to prevent it from happening in the first place.
There you go. Sounds great. Good advice. This next one, I'll have to get a little bit closer. There was a study, I'm not sure if I sent you the link, it was on the BBC article, I guess, that treated 3 patients with alopecia with a drug for bone marrow disorders called ruxolitinib, and all 3 of these people with alopecia saw total hair regrowth. And the question was, are you familiar at all with this study or any studies that show, is there any validity to this? Have you any knowledge on this?
Well, I looked at the actual article that you sent me,
Yeah.
and it did, obviously those 3 people did benefit from that medication quite a bit.
Sure.
So those would really be considered, case studies or case reports, because they're individual people.
Right.
I don't know if there's any. I don't think that there's any large-scale interventional studies on this. This drug is actually an anti-cancer drug.
Okay.
So it's traditionally used to treat a blood cancer.
Okay.
And as many people out there know, whenever you have a anti-neoplastic drug or an anti-cancer drug, the side effects are horrific.
Yeah.
So this drug actually, for anybody out there who wants a really good reference on any particular drug, just go to Google, put in the drug name, and then put in Medscape, MEDSCAPE, and you can come up with a Medscape. It's you can go on there. They have the drug. You can see how it works, what it's used for, what the adverse effects are, all kinds of stuff with it. And when you look this drug up on Medscape, and I actually looked it up at work too on Lexicomp and clinical pharmacology. Those are some resources that physicians and pharmacists have that the public doesn't have.
Right.
But it all says the same thing as far as adverse effects. It can cause anemia in 96% of the patients.
Okay.
It can cause low platelets in about 70% of the patients. So if you have low platelets, then you can't clot very well. So now you're bleeding and you're bruising easier.
Yep.
So a quarter of the patients will have bruising. It reduces your white blood cells. It can cause liver damage in up to like 17% of the people. And cause headache in about 15%. So a lot of these, this medication there's just so many side effects with this.
Yeah.
And again, I'm not saying to use it or not use it to regrow hair, but you have to look at these side effects.
Right.
And you have to look at what you're getting for hair growth, and is that worth it to you?
Right.
Not to mention that I almost guarantee you the insurance company is probably not going to cover this for hair growth because there's no large-scale studies. So I don't know how many of hundreds or thousands of dollars this drug is, but I know that these new specialty drugs like this
Yeah.
usually run in the thousands or tens of thousands or even hundreds of thousands of dollars.
Yeah. That's another great point. That's a great point. We only have a few more here to finish off with. I think 2 or 3 more here. Let's final push. Any recommendations? Any over-the-counter recommendations for creams or rashes? For recommendations for over-the-counter creams for rashes. Again, a very kind of a vague question.
Yeah, I guess it depends on what kind of rash it is.
Sure.
Is it a rash because you got bits by some mosquitoes or something, and it's just irritated? Then maybe something like hydrocortisone cream or Benadryl cream might help you out good there. But is it a rash? Maybe in the groin area or down by having athlete's foot, and it's a fungal infection. Then something like Lamisil would work better because that's an antifungal cream. So it completely depends on what the rash is from and what you're treating. You certainly you don't want to use Lamisil on just a mosquito bite because that's not due to a fungus. And if you use hydrocortisone on a fungal infection, it's not going to fix it. So you really got to know what you're treating and go from there.
It certainly varies from rash to rash. See your general practitioner or see a dermatologist. Any herbal or natural recommendations for lowering cholesterol? I think we kind of already went over this, keeping your dietary cholesterol low. But let's say someone may have a chronic hyper cholesterol. Any natural remedies to lower it?
Well, of course, I always recommend doing a whole foods plant-based diet because most people will be able to get their cholesterol down, usually below that 150 mark for the total cholesterol, which is where you're kind of heart attack proof, by just changing what they eat and being diligent with that. Now, if you don't necessarily want to adopt that diet, or maybe you do adopt that diet, maybe some people are more genetically predisposed to having high cholesterol. So there's 1 in 400 or 1 in 500 people will have familial hypercholesterolemia. And that's where, they just have a genetic problem with one of their genes and how they're able to clear cholesterol. And no matter how good they eat, they're going to have high cholesterol. Usually in those cases, you need a small dose of a prescription strength lipid lowering drug to get it down to that 150 mark or below. But as far as natural remedies, the only one that I can think of off the top of my head is red yeast rice. And red yeast rice is actually it has lovastatin. It is lovastatin. It's like a less powerful version of lovastatin. So it's kind of like a statin.
Interesting.
It reduces your total cholesterol levels by about, I think it was about 15%, about 13 to 15%, and your bad cholesterol by about 20%. So that's actually a pretty good drop right there. Now, like I said, with any supplement or medication, there's always going to be possible side effects. And with red yeast rice, it's not uncommon as well to have side effects with that. So some people will get GI symptoms. They'll have abdominal discomfort or heartburn or some problems there. And then also it is a statin, and the statins can increase your liver enzymes, so it can cause some liver damage. So you just want to be careful. If you're going to take that, you need to tell your doctor and make sure that he's monitoring you for that. Now, it's probably less likely that's going to elevate your liver enzymes than the statins because they're a little bit more prescription strength, but that's still there. That chance is still there.
Good. That was good advice. Last one here. Let's do it. Someone said they have a reaction to direct sunlight, a disorder called polymorphic light eruption X. Doctors are giving her steroid creams to treat it, and she's looking for any natural remedies that you're aware of.
I actually am not familiar at all with that, so I don't think I'm going to be very much help at all. I'm sorry, but I'm not familiar with that.
Okay, no, fair enough, fair enough. And I want to always, with all my interviews, give the last word to my guests, and also along with that, feel free to mention how people can find you and may be able to connect with you.
Yeah, well, I really appreciate you having me, Ian, and it's been a pleasure. I think that I really admire the work that you're doing too, and being out there and being the plant-based cyclist and showing that you can eat well, eat healthy, stay active, and still compete at a pretty high level.
Mm-hmm.
So it's very admirable to see that in you. And we all just need to do our best to spread the word of eating healthy through a plant-based nutrition plan and staying active. And that's how we're going to fix this healthcare crisis. And you benefit as the person listening out there right here. You benefit the most in taking control of your health.
Mm-hmm.
It's not your physician and your pharmacist and your nurse and all your healthcare providers are not waking up and getting out of bed every day and going, man, I wonder how Joe's doing, with his whatever disease he has, or I wonder how Mary's doing with whatever disease she has. We see you in the office or in the hospital. We do our best to kind of get you back up and running, but ultimately, it's your life.
Mm-hmm.
And you're only given one life to live and one body to live it in. So take care of it.
Yeah.
It's important to take care of it.
Absolutely.
And as far as where people can find me, you can just go on my website, plantbasedpharmacist.com. And there's all kinds of information on there. My articles, my blog, my book is on there if you want to check that out, The Empty Medicine Cabinet. And yeah, you can find me on there. I'm on social media, Facebook, Twitter, Google+, all of those. So you can check me out on there too.
Great, great. And thank you for the interview you just did with me. It just got published today, and it looks great.
Yes.
And
Yeah.
Say again.
A phenomenal interview. When I posted it and told people that this guy bicycled across the entire United States on a plant-based diet, that piqued their interest right there.
Yeah. And I will, in the introduction, put a plug in for your book, and I'll show what the actual cover looks like. So, again, for the second interview we've done, thank you so much for your time, Dustin Rudolph.
Thanks so much, Ian. Appreciate it.
Bye-bye.
Bye-bye.